Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning has been on your health. And my next guest, he oversees the health of more than 30,000 underserved residents in Milwaukee. Dr. Tito Izard is a graduate of the Milwaukee Public School System. He's an alumnus of Marquette University and the University of Wisconsin-Madison School of Medicine and Public Health. How are you, Dr. Izard?
Good morning, Andrea. How are you?
Always a pleasure to talk to you. I'm doing well. Thank you. And needless to say, you've been a guest on this show on many occasions. And we've talked about the coronavirus and how it has disproportionately affected African Americans, Latinos, and Native Americans. And COVID-19 has killed over 300,000 people in the US, and many of those who died had underlying health conditions like diabetes, hypertension, or obesity. So the last month has been focused on the coronavirus vaccine, and there are many conversations and surveys that are primarily focused on the number of people who don't trust taking this vaccine. What are your thoughts when you hear these conversations take place?
Well, I think these are very honest conversations, and it's great that we're having them. Realistically, though, there are conversations that are happening later in this whole pandemic than it should have. Most people are through the pandemic, though, the rude awakening of how COVID-19 has impacted and affected minority vulnerable populations are starting to see the things that we've been talking about for years, how health disparities go beyond just issues of poverty. There are a lot of other factors that play a significant role into why people may suffer greatly from certain conditions like COVID-19 or cancer disparities, cardiovascular disease, infant mortality, and as well as many other health conditions. So when we look at, particularly for American descendants of slavery, African Americans, that health disparities are a direct consequence of being an American descendant of slavery, because those health disparities have existed since ever since we've been here in this country.
Wow. So I want to talk about the history of medical exploitation of African Americans over the course of history and how that's playing a role with how many people are feeling in regards to this vaccine in particular. We know about the Tuskegee experiment that was conducted between 1932 and 1972. It was a major violation of ethical standards. And then there's also the unconsented harvesting of Henrietta Lacks's cervical cells, which are still cultured and used today. I think it's safe to say that they both play a huge role in the trust gap that exists. And there have been stories and, made for TV movies and things of that nature dealing with both of these stories in particular, but it doesn't stop there, right?
Yes, and just like I was mentioning, it really does go back to the existence of American descendants of slavery here in the United States. Ever since the beginning, slaves have been used. Slaves were originally considered, they could be used as currency, as collateral, and as debt. So the Black body was used to the advantage of the economic system here in the United States. So slaves, even with doctors, where doctors, the Hippocratic Oath, where we say to do no harm, even for doctors, how they utilize the Black body to advance the science, but not necessarily to advance African Americans. So, for example, Harriet Washington, here in the book Medical Apartheid, she talks about things such as Anarcha, who was a 17-year-old slave girl who Dr. Marion Sims performed over 30 surgeries, gynecological surgeries on her without anesthesia during that time frame. And he was is still known as the father of modern gynecology. And so things such as that, what you described with the syphilis situations, even up to the 1970s or so, where you had African-American females receiving hysterectomies without their full informed consent. And so there's a long history in America of how the Black bodies have been used inappropriately, not necessarily for vaccinations, but just in the healthcare field. And even today, medical students who are surveyed, even today still think that Black skin is thicker than white skin, and therefore Black people experience less pain than white patients experience. So there's a lot in the medical field that results in a distrust between African Americans and the majority society. And that just plays out in the conversation on vaccines.
Okay, and the title of that book you held up again is Medical Apartheid.
Yes, the medical apartheid.
Wow. Okay.
Yeah.
That's one that people should put on their list. So I guess my question for you, Dr. Izard, with all of this being said, how do we get past these instances of medical abuse to convince people that things are different and that they should just get this vaccination because people are telling you you should?
Well, I think that respectfully is exactly the wrong question to ask. And the reason why I say that is you cannot insult people for 400 years, utilize their body for your own personal gain, and then to say, well, just get over it. You know, it doesn't work that way. Really, what we have to have in this country is a restorative health equity plan for African Americans. And that is just one component of a comprehensive reparations plan to try to make sure that Black bodies are economically included in America. And with that process would allow us all to achieve better health. So one of the things I like to talk about is if you actually define health as stability between the mind, body, and spirit, because of all the historical health insults and other things that we just discussed, for African Americans as a group of people, we've never experienced stability in the mind, body, and spirit. And so it starts to make sense why health disparities exist. So until we actually are able to address it from a comprehensive perspective, which would be a comprehensive reparations plan, with one component being restorative health equity, we will find that we will continue to have these conversations.
So there's a lot of work that has to be done. That's
Right.
basically what it boils down to. Because you have Dr. Anthony Fauci, who during an event hosted by the National Urban League, he said that a Black woman, Dr. Kizzmekia Corbett, was at the forefront of creating one of the vaccines. And then there were Black doctors and nurses who took the vaccine on day one of its availability to healthcare workers with hopes of changing people's mindsets. But you know, I do radio full time and we keep asking people, does this change your way of thinking? And most of the people say no. So I think that some time is going to have to go by. People are going to have to see for themselves and feel comfortable on their own level on, you know, proceeding with how they want to do this. So on another note, I definitely wanted to bring this up because Milwaukee Health Services Incorporated employs more underrepresented minority physicians and health practitioners than any other medical facilities in the state. So with that said, some months back, you and a few other community leaders from Milwaukee, you were on a conference call with representatives from Mike Bloomberg's campaign. And I bring that up because most recently, Bloomberg, who of course is the former mayor of New York City, he announced that he plans to give $100 million donation to 4 historically Black medical schools to ease the financial burden of about 800 medical students at Charles R. Drew University of Science and Medicine, that's in LA, Howard University College of Medicine in DC, Meharry Medical School in Nashville, and Morehouse School of Medicine in Atlanta. I'd like to think that you and your expertise had something to do with really getting that information across to them. What are your thoughts when you hear about this huge donation?
Well, I think it's great that one individual through philanthropic means is doing something to address it, but this has to be something that is addressed much more comprehensively than the actions of one person. So even when we look at Black physicians, what our conversation earlier was talking about American descendants of slavery. When we look at actually Black physicians today in medical school that are starting, only 45% of those Black doctors actually have historical lineage to slavery. That means 55% have come to the United States mainly after 1980 or so. So, you know, the whole experience of that Black doctor versus the experience of someone who has, you know, 7 generations in this country, Yeah, it makes a big difference, as well as the fact when we look at repatriated dollars or dollars that people will send back to their home country, which is great for their home country. But if we think that those dollars are going into Black communities here in the United States, those dollars are not going into the same location. So billions of dollars are being sent out every year, which many people thought were staying in Black communities here. So I definitely think there needs to be Black doctors of all sorts, but we cannot forget about American descendants of slavery in this process. And I do want to thank, though, Advocate Aurora, for the Better Together Fund actually has just provided $200,000 pilot funds for us, Cream City Medical Society and Milwaukee Health Services and others to start a pipeline of practice to specifically address the lack of African American physicians in our community.
Well, thank you, Dr. Izard, for all that you do. You know, you're my go-to person because you always bring it. Anything I need to know about, you're always ready. So I appreciate you taking the time out of your busy day to inform me as well as the viewing audience. Thank you so much.
Well, thank you for your time.
Always a pleasure. Happy New Year to you.
All right, bye-bye.
Dr. Tito Izard is the president and CEO of Milwaukee Health Services Incorporated, a nonprofit federally qualified community health center with locations at Isaac Cogg's Health Center at 8200 West Silver Spring Drive and MLK Heritage Health Center at 2555 North Dr. Martin Luther King Jr. Drive. Call 414-372-8080 or visit their website at mhsi.org. That's going to do it for today's show. I'm your host, Andrea Williams, as always. Thank you for watching, and I hope you join us again next week as we take another look at our issues, Milwaukee. Happy New Year to you.